Alcoholism, drug addiction, compulsive gambling, just some of the societal problems that the State Office of Alcoholism and Substance Abuse Services works to prevent and treat. The agency, known as OASAS, also runs 12 addiction treatment centers across New York. But doing these jobs lays an extra cost on taxpayers, the cost of overtime. Just consider what the top overtime earner made in the last fiscal year, a downstate psychiatric nurse with a base salary of over $74,000, pulling down an extra $25,000 in OT. Other nurses and addictions counselors in the top 10 making between $10,000 and $25,000 in overtime a year.
There's really no oversight within state agencies on the managerial level. There's no red light that goes off in any state agency when there's a spike in overtime.
Senator Jeff Klein chairs a task force on government efficiency and says taxpayers shouldn't have to pick up the tab for excessive overtime at state agencies.
When we're asking New Yorkers all over the state of New York to tighten their belt, to do more with less, balance their checkbooks, I think we have to stop giving agencies a blank check as well.
Records we obtained show total overtime costs at OASAS stayed about the same over 2 years at just over $1 million. We wanted to ask Commissioner Arlene Gonzalez-Sanchez, seen here at the stock exchange, what she's doing to reduce it. But her staff didn't return our repeated calls, saying only in a statement that the costs are health and safety related.
The question is, are the staffing levels appropriate? Certainly, if there are emergency situations, nobody's saying that there will never be overtime.
State Controller Tom DiNapoli wants to know if agencies like OASAS could save money by just hiring a few more people, especially when overtime can figure into employees' salaries when they retire, upping their pensions.
Do that cost-benefit analysis, because overtime costs, it's an upfront cost and also is an ongoing cost in terms of pension costs down the road.